backyard, reminding you, Raleigh, that everything you need is right here in your backyard. And when you shop local, Raleigh, you get better goods and services. Today is Monday, so once again, time for Dr. Susan Lovelle of Premier Wellness, who has been gracious enough to provide us with the weekly update. Thank you for joining us, Dr. Lovelle.
It's so wonderful to be here. Thank you.
Um, so I'm just going to pass it to you. You're the authority. What's new in going on with the quarantine and this virus?
Well, I think the biggest thing with the quarantine is that the quarantine is starting to be lifted in various places. And, it's going to take a little bit of time for us to see the final effects, whether it's good, bad, or indifferent. But what we are seeing and noticing is that the areas that have opened, say for instance, Georgia, that
Right.
they're seeing an uptick in people coming from other states that have more strict regulations still in place. So that's something that we're also going to be needing to watch as well. So not just the numbers in Georgia itself, but in the states that are actually kind of trickling in to get the services that they've been missing for the last couple of months.
Oh, I see. So South Carolina, for example, might cross the border for a restaurant or a retail space and then bring it back with them.
Exactly, exactly. And one of the biggest states they were saying is Florida. Florida, so
Mhm.
people from Florida traveling to Georgia to get, to get their hair done or to do whatever that they want to do. And so we'll, like I said, we will have to see. There's no way to say one way or the other right
Right.
now. We're just gonna have to see what happens. Yeah.
Um, Last time, just bring this up real quick, we talked about a medicine that was having a positive effect for a minority of the worst cases. Has there
Mhm.
been any other development on that or the vaccine?
Not yet. That's going to take a while.
Okay.
And so, what they'll be needing to do is multi center studies with various patients in different levels of infection. So, that's going to take a little bit of time.
So,
But mhm.
oh, I'm sorry.
No, I was going to say, as you were saying, it is hopeful. And so, we're all kind of keeping our eyes on that. But it'll take a bit of time for that.
Well, as we've mentioned, then it's vaccines, a medicine that's not coming, or quarantine, right? So we take care of ourselves, and
Ex-
that's the highlight of our conversations.
Right, right.
Keep your immunity strong and take care of yourself. So, um,
Yeah. So, essentially that points right into what I did want to speak about today, is that what we call the SDOH, the social determinants of health.
um,
But it's really just kind of saying, to put it in a different way, that your zip code is more important than your genetic code,
oh,
really, as far as health is concerned. And we're starting to see that in various areas.
I can imagine a lot of factors that play into that, from government to socioeconomic. Am I on track there? Are those the key?
You are absolutely on track. And so, right now, there are just a few states that are starting to really break down the cases, the caseloads, not only by did you get it, did you not get it, but who got it, what areas are getting, what is the ethnicity, what is socioeconomic class. And we're starting to see wide disparities between who is actually contracting and then having a more severe case, and as well as those who are actually dying from this disease.
Right. I can see that. I mean, there's been blatant discrimination for hundreds of years here. Um,
Mhm.
and so it's not only your zip code, say Raleigh versus somewhere in Georgia, but even within Raleigh, the zip code's going to
Right.
have a major impact.
Exactly, exactly. And but that's the kind of information that we need to not be afraid to actually look at. You know what I'm saying? It's there.
Right.
We can use this time to find this information, and then once we do have it, then make changes in our public health so that we don't have these disparities going on
Right.
in the future.
Um, I believe we're going to find that to be absolutely the case, and the numbers will just pan out to what degree and where exactly. Um,
Mhm.
do you have any prescription, doctor, for anything we can do now while we're sitting at home to maybe start having a positive effect toward equalizing this health issue?
You just walked right into my trap. when
Ah,
you, when you said sitting at home. So that is absolutely probably the number one thing that we can do is to get up and start moving. A
Oh,
lot of us, I see a lot of us outside walking, but that is one of the number one reasons why the United States is having such a rough period. Not just the genetics, but the fact that we are more and more a sedentary population.
right,
And so exercise does a wonderful amount, not just for our heart, but also for our immunity. And so
right.
getting up and moving is going to be key.
I found it's also good for my mental state to get out there and run off a yaya or two that's bouncing around in there. Boop, boop, boop.
Exactly, exactly.
Um, I would also encourage our audience, though, to if you're going to be on Facebook, and I know you are watching us right now on Facebook, but to address this inequality, to bring it up, maybe post something on your feed, and any of your friends that agree with us and want to talk about it, let's start a dialogue.
Yes.
And I would love for your backyard friends and friends of friends to go ahead and start addressing this today in a manner. So I encourage everyone to address it and maybe start posting, and feel free to tag me, please. Um, um, Dr. Lovelle, any other key issues that you wanted to touch on, or?
I really just wanted to thank you for being willing to have this kind of conversation. I mean, it is so important and so critical. And I think that COVID-19 was our wake up call for a
Yes.
lot of things. But now we have the opportunity to make these changes. And so thank you very much for allowing me to bring it up and for actually magnifying this to your audience as well.
Well, it's the power of local all over again, Dr. Lovelle. If we want to have a national change, then we need to start in our own backyard. And
Yes.
Raleigh is such a unique and diverse place that we should be an incubator. We should be trying new ideas, and those that are successful passing right along into the other local communities. So, and not to have a love fest, but we love you, Dr. Lovelle. You've been very gracious to spend your time with us. And please keep us top of mind if anything comes up. And otherwise, we'll be here another Monday. Before we leave, if anybody's interested in getting in touch with you, what's your best phone number?
My phone number is 919-925-5910. And I did want to say that tomorrow evening at 7, I will be doing another webinar on inflammation and how you can actually change the inflammation that's in your body so that you can be healthier and reach your optimal wellness.
Inflammation is a big topic in our special needs community because it affects so many different diverse organs. And
Absolutely.
well, Raleigh, Robert Court's telling you, no, demanding that you focus all of your wellness energy right here in your backyard. Remember, when you work with the local wellness provider, they're going to spend the time with you that you need to make a proper diagnosis. They're going to provide a holistic approach, and if need be, also to refer you to other local professionals. Dr. Lovelle's done that for me. She's done it for us, and she'll do it for you. Thanks again, Dr. Lovelle. See you, Raleigh.
Thank you. Bye-bye.